Okay, so my topic that I decided to do for this in-depth week is virtual reality and cognitive therapy treatments. First, virtual reality is the idea of immersing a viewer in a 3D computer-generated world. The goal of this is to have the movements in real time so that the viewer doesn't notice any differences than they normally would see in the world around them. This is done by adjusting screens and sounds depending on the actions and head movements of the viewer, depending on what type of virtual reality technology they're using. Um, technology uses for this mainly have been in video games and kind of fun things, watching movies. They're starting to come up in education more, and now we are looking into therapy uses for virtual reality. The first article that I dove into last week, a little refresher of it, is on virtual reality and the fear of heights. So for this one, they use an avatar therapist, so a therapist also using virtual reality or just a computer programmed therapist is working with patients. They're immersed in height situations virtually, and they found that people are more likely to confront their fears when this danger isn't actually real, so they can just, take off their virtual reality or stop the session, and they're no longer in that situation. So it makes them more likely to confront their fears and want to make changes towards them. In this study, they found there was a decrease in the fear associated with heights in these patients, but they did say that further study would be needed to see if it would continue to work or if it would be helpful in other situations. I found another article associated with public speaking anxiety. So they describe public speaking anxiety as an anticipatory anxiety or an in situ fear of public speaking. So like that kind of sweaty palms, nervous limbs, nervous voice. You can kind of tell. Public speaking anxiety can come in all sorts of forms, kind of on a continuum. The people in this study were like the really, really drastic cases of it where public speaking is not an option for them whatsoever. These sessions involved 8 exposure exercises. So the first part of the session, they kind of evaluated the patient and figured out where they lie on this continuum. And then they went into the 8 exposure exercises, each one increasing in the severity, and this severity was dependent upon the individual participant. So depending on what caused their anxiety trigger when they're public speaking or when they're getting ready to do it, that is what they incorporated into the treatment. So it would vary from patient to patient. This study saw immediate improvements in public speaking, and it also suggested moving towards the treatment of fear of spiders. I'm not exactly sure how they got that correlation between public speaking and fear of spiders, but it must make sense, or that's just the next study that they wanted to do, similar to the fear of heights. Something that a lot of people have is a fear of spiders, so it would be relatively easy to find participants for it. My next article was on driving anxiety and aggression in veterans. So they found that in post 9/11 warfare, there were increased instances of roadside bombs and IEDs, which would cause an anxiety trigger when driving or when operating motor vehicles. And they also found that there were several kinds of cues that would cause this anxiety or aggression, and that would be being boxed in. So like you have all cars around you on all sides, or seeing unexpected items on the side of the road. So maybe just on a trash collecting day, you see a bag of trash on the side of the road, or you see a shoe on the side of the road, and that for whatever reason triggers trauma in veterans. So they also noticed that because of these trauma cues and because of the roadside bombs overseas, soldiers and veterans have adopted driving maneuvers to help them avoid that. So whether that is speeding or drastically swerving or driving down the middle of a lane and instead of staying on their side of of the road. These are all things that these drivers have adopted in order to survive, which when they come back to the U.S. are not safe driving standards. So it causes problems when they're operating motor vehicles. In this instance, the virtual reality was set up as a driving simulator, so they basically had the front part of a car set up. You had the steering wheel, you had the seat belt, but you also had the virtual reality goggle, so you were able to actually physically drive instead of just watching the driving happen. Some feedback on the study was that the simulator wasn't completely realistic. So, unlike other types of VR where they had tried to make it completely immersive, where you feel like you were there, the participants in this study kind of knew that they were being studied. It didn't feel like they were actually in a car driving. There was some sort of disconnect between the simulator and real life. However, even with this unrealisticness about it, they still found that the study did lower levels of driving anxiety and aggression. This aggression would be kind of like a road rage thing, but they found it higher in veterans in some areas. But they did find a decrease in it given this study, so that was rather promising in their eyes. They did have some setbacks with it, that they only studied male participants, and it was a relatively small study, and I think they had participants from a specific area overseas where it might be different depending on where you were stationed when you were active duty. My next two articles focused on post-traumatic and depressive symptoms as well as suicidal ideation. So the focus was on the PTSD and depression in veterans, and then the suicidal ideation in active duty soldiers. The active duty soldiers were either stationed in Iraq or Afghanistan, and that was their participant pool there. Both studies showed lower levels of PTSD and depressive symptoms. For the one study, they noticed that when PTSD decreased, the depressive symptoms did as well. However, there was no reciprocal relationship, so it kind of suggested that PTSD was partially causing the depressive symptoms. However, when they were curing the depressive symptoms, it didn't necessarily get rid of the PTSD. And then later in the study, they hypothesized using virtual reality to but to create new memories to replace the old ones relating to trauma. So it's a pretty common cognitive therapy put into place now without the use of VR, but it's kind of a lot of your reaction to a situation is based on memories in your past experiences. So in traumatic situations and in PTSD situations, these memories would play a huge role in it, but it would also be somewhat difficult to override the memories. For example, if you have a fear of heights, you can kind of replace a bad memory with, having a good hike on a cliff and, having it be positive. Whereas if your stress and post-traumatic symptoms are stemming from overseas and being an active duty soldier, you would have a little bit more of an issue replacing that memory. So they hypothesized using the VR to replace those memories and hopefully either treat the PTSD and depressive symptoms further or treat other issues that are associated with those. My last article I found was on the treatment of schizophrenia. So schizophrenia is considered a syndrome involving variable and disruptive psychopathic or psychopathy, and it affects emotion and perception and other behaviors. So you can kind of perceive things differently in a sense of almost hallucinating. It affects your emotions. You can have the ups and the downs, almost like a roid rage without taking steroids kind of thing, or you could, be happy all the time and then split second you're something else. So it makes everyday life a little difficult. It makes holding down jobs pretty difficult, depending on how well you adhere to your treatment program. So in this study, they chose to use patients of poor adherence, so those that were highly non-compliant with their current form of treatment, which is both the pharmaceutical treatment and psychological treatment. After this study, they did follow-ups every 6 months for 18 months, and then they followed them up at the 5-year mark as well. So within 18 months, only 2 of the 10 people studied, is a relatively small sample size, but only 2 of the 10 were hospitalized, but they did it voluntarily, so it wasn't a necessary hospitalization. They chose to do that, and then 2 of the 10 had also gotten jobs. At the 5-year mark, 5 of the 10 participants were fully employed, and they noted that this study allowed for reintegration into society, that all the participants had decreased psychoses, and they all had increased self-esteem. So they kind of said it wasn't necessarily the goal of the study to see them have increased self-esteem and get back into society, but it was definitely a plus to view that and see that that the treatment using VR kind of overflowed into other aspects of their lives. They also said that VR was not used as the sole treatment for it. They stuck with the pharmaceutical and psychological treatments that were already in place, and they just added VR as like an extra oomph. So they said the addition of it was very beneficial, and they would continue testing that and seeing how it would work in other areas as well. So where it could be headed with all these articles, each article had great results. Not fantastic results, like not every patient was 100% cured, but there was some sort of positive result from the treatment, and the articles that I found were a decently wide range of cognitive disorders that were studied. So you had the PTSD, fear of heights, public speaking, schizophrenia. Some things like the fear of heights are like perceived anxieties. Schizophrenia would be an actual cognitive mental disorder that you'd be born with. So you can see it's beneficial to a range of disorders. Personally, I think it's beneficial to do more studies involving it. I don't think it could really hurt in any way. And it appears as though it could be used to treat almost anything. So I can only imagine in 5 years what they'll be studying with it, because it seems so beneficial on this small scale study right now that it really could go anywhere.